and I want to introduce Dan Rigby to you. Dan, hopefully you're there and you can step in for us. Now, Dan represents an organisation within the NHS family called Step Into Health. I'm not going to say any more, otherwise I steal his thunder. So Dan, over to you, and I know you've got a slides deck to present, and we'll try and make contact with Jill. Okay. Thank you, Dan.
Thanks, Paul. Happy to step in. Hello, everybody. Dan Rigby. I'm the Senior Programme Officer for Step Into Health programme, and I'm going to give you a quick introduction to what we do, who we are, and how we can help you. If we go to the next slide, please. And the next one. So this is our team. We are led by Katie Waller, as the programme lead, and I work alongside Katrina Logan, who is our programme assistant. I am a veteran myself. I've worked in the military for 18 years in the Royal Air Force, and I joined the Step Into Health on a 12-week intern programme, and now I'm in the role of Senior Programme Officer, so I am a product of the Step Into Health programme. So next slide, please. Okay, so who are we at Step Into Health? In a nutshell, the Step Into Health programme connects candidates from across the armed forces community with employers and opportunities in the NHS. We cover England and Wales, and Scotland has their own version of the programme. We were founded in 2014. It was the Royal Foundation, together with the Walking with the Wounded charity, working alongside the NHS in Norwich, giving opportunities for the wounded, injured and sick community of the armed forces an opportunity to work within the NHS. As you can see on the slide there, who do we support? So we support service leavers, and also veterans, reservists, and the cadet force adult volunteers. And hopefully we'll hear from Jill after this, who is part of the military family. So we also support spouses and children of serving personnel. I've got key transferable skills on there, but I think David and Rob done a really good job of describing those. But they are very spoken about by us as veterans and service leavers. But all these kind of transferable skills are very much wanted and needed within the NHS. Next slide, please. So how do we reach the community? I think with the audience I've got today, you've made the first step by being on this webinar. So I will concentrate on the candidate system. This is a system that you can register on to create an account. It will ask you for some details, what organisations you're looking to maybe transfer into, and what areas of the country that you're looking to move to or live in. And it will ask you for some key skills and your backgrounds. And what that system will do is will highlight to the geographical area or certain NHS trusts and certain job roles. And what that will do will then prompt an armed forces champion within those organisations to contact you and start that conversation for you. And what will go from there is then they can offer you insight days, work experience, or just a chat to bolster your applications for the roles that you're looking to move into. Other areas on that slide are self-explanatory, but we are trying to get in touch with the whole of the community and various ways that we do that. So CTP, so Career Transition Partnership Fairs, we do 6 a year, and we're currently just signing up to the ones for 2025, with Salford being in February and Bristol being in March. So there's more to come on that. But all this information can be found on our website. Next slide, please. So if you want to get the process started on the candidate system, that is the QR code to do that. All this information will be available after this event. So QR code it now, or we can move on. Next slide, please. So why the NHS? 350 plus career opportunities with NHS. The Health Careers website will give you details of all of those. The employee benefits are very standard, but what I want to pay particular attention to is why the community transitioned to the NHS already. And as you can see there, the culture is number one. The fact that they are a teamwork, ethics-based organisation really lends itself to the skills and attributes that we bring from the armed forces. Benefits are high on the score. Skill set are very suited to career progression in the NHS. Stability and a work-life balance. Next slide, please. So the other side of our job here at Step Into Health is that we get the organisations to pledge to us to support the armed forces community. So currently we actually have 166 as of this week. And what they've pledged to do is to break down the barriers to you as the candidates of transitioning into NHS. So this can be done with insight days, having armed forces champions and a network within the organisation to support you as candidates through the recruitment process, but also whilst you're in your job. Key ones for you, the audience today, would be is starting those conversations with the armed forces champions. What you can do is get some volunteer opportunities or insight days at the organisation, and really will boost your application to the careers that you're looking to do. Next slide, please. So a snapshot of the 350 plus careers within the NHS. I know we're talking about podiatry today, but if you've got family members or colleagues that are looking for another career or a changing career, there literally is all the careers that you can think of, from digital and cyber all through to the doctors and nurses. But more information, as I said, on the Health Careers NHS.uk website. Next slide, please. This is just my guide for yourselves going through the process of applications. These really will help you succeed in what you're looking to succeed in. So make sure you explain in your application how you hit the essential criteria. Now, these are going to be the buzzwords they have in their job adverts, and it's really essential that you do make sure you give examples of where you hit those criteria. We come from a team-based environment, so it's very important that you change we to I. What have you done? How have you achieved something? And how have you made a difference in examples that you provide in your application? Use the contacts that you get through the Step Into Health process. Like we've already mentioned, we're all here to help you through that process. Use us and we can help wherever we can. On applications, there will be an AFI, so that's an Armed Forces Indicator or Identifier. What that does, it benefits you, doesn't disadvantage you at all. This actually notifies that the recruiter that you are Armed Forces community, and some of the pledged organisations will actually have a guaranteed interview scheme, whereas if you hit all the criteria that they're looking for, they will guarantee that you'll be part of the shortlist for interview. And lastly, talk and connect. Knowledge is power. It's not what you know sometimes, it's who you know. So have those conversations and use us as a tool to boost your applications. Next slide, please.
I think that's it, Dan. I think that is it. I think
we've actually lost a couple. But
that's
yeah,
all
so
right.
all the
Don't worry.
information's on our website. Thank you for your time today, and any questions, pop them in the chat and I'll answer them as and when I can.
And I think somebody's popped in your QR code that you've been good enough to show. So that's in the chat for people to take. And I really like the bits of advice that you gave about, you know, I rather than we. I think that is important. That is so important when it comes to that important thing. But it's also, people do need to be realised that a lot of the universities now are engaging with the armed forces community. So if you make it very clear that you've got that as a background, then that helps with the application going forward. But thank you very much for your time this morning, Dan. As always, Step Into Health, and we work very closely with them. So thank you very much.